And good morning, afternoon, I guess, at this point, just after 12 o'clock Eastern Time. I'm Dr. Duke Majan, neurosurgeon, founder and CEO at Duke Spine Institute. Our live stream is going to be for spine surgery done on the cervical spine or neck. And the patient has 2 herniated discs that we'll be repairing today endoscopically with a laser. Anywhere else that he goes, he would be recommended for either a fusion called an ACDF or a laminectomy infusion or an artificial disc. But at Duke Spine, we offer those surgeries as well, and we offer a new type of surgery that's far more advanced, safer, and better for the patient. It is arthroscopic surgery to go in and use a laser to clean the back of the disc where the herniations are, but leave the rest of the disc alone. And that way the patient doesn't need a metal plate, a cage, an artificial disc. They keep their own natural disc, which is better for the patient. The surgery is done without blood loss. We'll lose a few drops at most. Patient's going to go home an hour after the surgery. Now this patient travels, originally he's from Turkey, but he comes to us now from Oregon. Traveled to Florida for this procedure because it's only offered here at Duke Spine. Okay. We're going to get started. If you have questions, feel free to type them up and ask me during the surgery. In the meantime, my first job here is the patient's facing up, looking at you, looking at the camera. His head is here, chest is here, body's down here. This is the neck. I'm on the right side. There's the Adam's apple. I'm going to go in and get into the disc. We're going to choose one disc first, 6-7. We'll fix that, then we'll come out and fix 5-6. So we got 2 discs to fix, 5-6, 6-7. Are you guys ready? All right, so let me get started. Henry, you're welcome to show our audience what are the 30 most common causes of neck pain in patients with neck pain.
Copy that.
I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. You can see from our animation video that there are about 30 causes of neck pain that are common. The most common is the disc. And right now I'm trying to finish the access shot of getting into this 6-7 disc. Shot. Let me do a little discogram. Shot. There it is. You can see the tear in the back of the disc. There's number 2. Let's go to bone 2. C2. Up. C2. C2. 2, 3, 4, 5, 6, 7. Everybody agrees? Take it off. All right. We've now entered C6-7, the hardest disc to get to in the neck shot. We were able to get to it, but it was not easy. This patient has a very high shoulder and made it very difficult to visualize 6-7. There is tremendous variation in anatomy. Some patients have an easy to get to 6-7. Most patients don't. Some patients it's impossible. This patient was hard, but we got it. I like to start at 6-7 shot because that is the hardest one to get to, and I want to start with the hardest and work my way up. Trying to get to 6-7, the bottom disc at the end of surgery, is much harder to do because there's some soft tissue swelling. All right. Very good. I'm making a 4mm incision. The entire surgery will be done through this 4mm incision. Let me have it. If you have questions, feel free to ask me. In the meantime, I'm going to keep working, and Henry will show you a video as to how is it that these herniated discs in the neck will cause so much neck pain. There's a reason for it. It's inflammation. But take a look at our video and you'll see how inflammation does that.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. At this point in the surgery, we have made a 4mm cut, tiny. We've lost maybe a drop or two of blood, and we're now getting ready to enter through the disc, going through the front of the disc. We're going to enter this disc. We're going to go to the back of the disc where the herniation is. Shot. And once I'm at the herniation, we'll use a laser to remove the herniation. This surgery is peer-reviewed and published in the medical literature. Shot. It's been peer-reviewed and published many times over the years. Shot. All right, let's get a quick AP. AP is a front-back view. We're looking from the side right now using the X-ray. I want to get a second view going from the front to the back. I realize we have a question. I'm going to take it shortly, but there's some other stuff I want to do first. Okay, very good. We're making our way off to the left side of the spine. That's where this patient has most of their symptoms. Huh? Shot? Yeah. I'm at the back of the disc. You giving me inline, you said? All right. That's probably as good as we're going to get. I may be able to get a little bit further. And do you have a question or comment, Henry?
Yes, we have both a comment and a question. This comment is coming from Santosh on Facebook, saying it's a beautiful surgery, but we can't bring this technique in the mainstream practice worldwide because we don't have this endoscope available anywhere. So Dr. Duke, please make it available and train other docs in this technique to make it a universally demanding procedure.
Yes, I appreciate your comments and sentiment. It's easier said than done. The reality is, Santosh, that it costs money, a lot of money. And the endoscope I have that I use is an endoscope that's no longer made by the company because the demand was so low, and it's a very expensive endoscope. It's very expensive to buy this equipment. So the company stopped making it, and I would love to make it, but I need money to make it. and I need money to train doctors to do it, and there's no money available. So in America, until our health insurance system is fixed, which it's broken right now for sure, Sean, then I can't do very much about it. All I can do is do these live streams so that people like you can see the surgery and hopefully help me make some changes to the way we treat patients with these issues. There's no doubt this is the best surgery in the world for a herniated disc, bulging disc, degenerated disc in the neck. There's no doubt about it. But just because it's the best in the world doesn't mean it's going to be available to everybody. Okay? I want it to be available to everybody, but just wanting something doesn't always make it happen. And I'm trying to get the word out because I can't do it myself. I need other people to help. Even governments can help. For example, a government in India could help. If the government created a fund. It's sad in America we have hundreds of billions of dollars, if not trillions of dollars, every year we give out to other countries for wars and things, yet we can't even take care of our own people, their health, which should come before war, in my opinion. So I want to make this available, my friend, but I don't know how to do it without money. We need money. And we struggle as it is every week, to cover our costs for what we provide. Our patients cover most of the cost of our surgeries. We do have some insurance payments, but not much. And I agree with you. Just because we've discovered a great technology doesn't mean it's going to be available to everybody. It needs to be. I want it to be, but I don't know what else to do. I need Jeff Bezos to sell his yacht. And can we get, I think, a little more light? I'm not sure. What do you think, Louis?
No lights on the right.
If Jeff Bezos sold his yacht and donated that money to Duke Spine, I could start training other surgeons. Buy a new endoscope. I can design my own endoscope. I've talked to Luis about it. The cost is too high. It's $500,000 just to design a new endoscope. I don't have $500,000 to put into a new endoscope. So that's just to design it and start the manufacturing and testing. But then to manufacture and distribute them, it's even more. So it's millions of dollars that I don't have to do this with. And I need it. I need that money. So in the meantime, the best I can do is teach by these videos. But thank you. And I'll do my best to try to do more. I'll always do my best. I'm trying to raise awareness to the public and to people like you, Dr. Santos. So I appreciate your comments. All right, so this patient comes to us originally from Turkey, and he's now living in Portland, Oregon. Or sorry, not Portland, but Oregon. I don't know exactly where in Oregon. And he's here with his lovely wife, and he saw the surgery that we do with the laser. He wants this for himself, and he did not want fusion. I don't blame him. He's having pain in his neck. You saw our video, what causes neck pain. There are 30 things that cause neck pain, 30 different diagnoses, 30 entities, right? You saw that. And for each person that I treat, I have to diagnose their specific cause of neck pain. In his case, he has, when I did my call with him, my Zoom call to diagnose his source of pain, he had disc pain from the discs, which we're fixing right now. But he also, I think, has facet pain. When I did his call, he denied facet pain. There's a herniation right there coming out. See that? It just slipped out from the spinal cord and the nerve root in the foramen, and there's more down there. You see that? All those pieces?
Yes, we do.
They're coming out. Those are pieces of herniation. They're recent within the last year or two, because the longer that the herniation is there, the more scar tissue forms, and then the herniation gets scarred down to the surrounding bone. All right.
We have a couple more questions.
I'll take your questions.
This next one coming from Hookem1963 on YouTube, saying, "Good morning. I have multi-level issues with moderate to severe disc protrusion, resulting in multi-levels of neuroforaminal enroachment. These issues are from C3 through C6. Can you do this many levels in one procedure?"
C3 to 6? Yes.
Correct.
We can do C3, 4, 4, 5, 5, 6 is 3 levels. We can do that in one procedure. We can even do 4 levels if we have to, but it depends on your anatomy of your neck, how thick your neck is, how collapsed the discs are, how big your shoulders are, how high your collarbone is, whether you've had prior surgery or radiation treatment or chemotherapy to your neck area. All those things are important factors that I look at in determining not just the ability for me to do the surgeries, but also the likelihood of complications or the likelihood of success. And so I have to assess that with each patient. I do that on a Zoom call. If you go to our website, and by the way, viewers, you can help us because right now we're having some issues, I think, with the MRI review submission. If you are considering having me look at your MRI, please take your MRI, your CD, your images, wherever they are, and get your DICOM images off that and send them to us through our web portal. That's dukespine.com. It'll prompt you when you get to the website, do you want to do a free MRI review? Yes, you want to. Fill out the questions and send us your MRI. Now you have 3 choices. You can mail it to me, you can take your CD or zip drive and put it in the mail and send it to Duke Spine. We give you the address to send it to. The other option is to take the DICOM images from your CD and sweep them off your CD and into our web portal. There's like a black hole on our portal you can just put it in. It'll suck them in. And the last option is if you have an MRI center that gives you login credentials where you can view your images, give us your login credentials and we'll go in there and pull your file and your image folder and we'll save it. After we get your images, we're going to then set up a Zoom call, and we have people from around the world that do this, and then we're going to diagnose your problem and recommend a treatment. But right now, this is kinking. You have to keep it from kinking. Right now, we need to know, is our website working? And we're having some questions because we have the new website, and we've had some issues with the MRI submission form. So if you could do me a favor while you're watching the surgery, for the next 30 minutes, please jump on our website, submit your MRI, and tell us if you're having any technical issues. I would love to know what the issue is. Is it allowing you to submit the form? Is it blocking you somehow? We have a team that's trying to troubleshoot it right now, and they don't know what to do. So I'm going to rely on you all to help us. Why not? Any other questions or comments?
Yes, we have another question coming from Royal ViewTube on YouTube.
All right. That sounds good.
Yeah, asking, Doc, what are the symptoms at level C5 to C6?
So when you have a disc injury at C5-6, that's the most common disc to be injured, by the way, and cause symptoms. And there are a variety of symptoms you can have. The most common is neck pain, and the pain will be localized to the C5-6 area, basically near the base of your neck. Then it can radiate from your neck, the middle of your neck at C5-6, down into your shoulders, either left or right shoulder, and even down your arm, and cause weakness, numbness, tingling down the arm. Those are all possible, okay? So weakness, numbness, tingling, and pain in the arm is one possibility. Another is neck pain, and another is headaches, and another is cervical brachial pain, which is pain radiating into your shoulder from your neck. This is an incredible mess back here. This patient clearly has huge bone spurs, and I'm shaving some of them down like this one, but the bone spurs aren't really the big problem for him. It's more the herniation, and the herniation is somewhat calcified. So I'm trying to remove as much as I can. As I've told you all before, we will never, no doctor can get 100% of the herniation. It's impossible. The more bone spur we remove, the more inflammation we create. I don't want to create a lot of inflammation for him. That means he's going to have some more pain afterwards that will eventually go away, but it'll be a more discomfort during the recovery. I don't see any more herniation, maybe this little piece right here, but that's it. I'm going to pull back the scope a little bit, the tube and the scope, and I'm going to see if I can identify any more herniation. Thank you, Luis. There's a little bit right there. I'll keep taking questions, but if you could do me the favor of trying to do an MRI form submission and tell us in the dialogue box if you're successful or if you've had some trouble. This is on our website, of course, that we're talking about, so you're going to have to go to dukespine.com. All right, Henry, any more questions?
No current questions, so in the meantime, why don't we show the audience of how we cure a herniated disc in the neck?
That's great, using a laser.
Exactly.
Thank you.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. I'm trying to remove this piece of herniation. You guys see it? I'm floating it out.
Yes, we do.
And the reason it keeps sinking is because it's dense. It's very heavy. What makes it heavy is calcium. Calcium makes herniations heavy. And why is there calcium? Well, there's calcium because when you have chronic inflammation that's going on for a long time in an area of your body, the tissues do get calcified. And calcium seeps in. You know, it's a lot like finding a fossil, right? Fossils are basically mineralized tissues of an animal or plant, and these tissues are getting mineralized by the body while they're still alive. These are damaged tissues. Doesn't happen under normal circumstances. It must be damaged. All right, we're pretty much done. I've gotten all the herniation I can get out of this disc. There's just bone spurs. We've gotten rid of some of them. We're going to move on to number 5-6. That was the 6-7. I'm going to do a little irrigating. We've never had an infection from this surgery, and we've never had a complication either. So it's a very safe surgery to do. We want to keep it that way. And no, I think we're okay. All right, keep the questions coming. In the meantime, we're going to move out of this disc. We're going to go up one and back in. So we just finished 6-7. We're going to move up to 5-6. The most common discs to be injured, 5-6, 6-7, 4-5, in that order, in the neck. All right, so because his shoulders are so high, they're blocking our view of the spine. We have to use we have the very best x-ray machine in the world, literally the best in the world. And now let's do some counting for the audience. So start at C2, 2, 3, 4, 5, 6, 7. We're counting the bones. So show us the next disc, Jordan. Yep, that's it. All right, so let's get started. We're going to pull out of this disc space, and we're going to move up to the next one. So start by removing my tube Shot. I'm going to leave the dilator in place. I'm just removing my tube. Feel free to type up questions as we do this. Shot. All right, now this we call the Duke spine slide, right?
Yes.
Yeah, this is the slide. And then we have the shuffle, the Duke spine shuffle, which is for the Duke plasma rhizotomy. That's when we're killing the pain nerves. We do the shuffle. But this is a slide. We're going to slide up along the anterior longitudinal ligament. Shot. And you got to do this by feel. You can use some x-ray guidance, but I got to feel the tip come out of the disc, which I'm right there at the precipice. There it is. We're out. Shot. You're going to see we're out. Yep. We're halfway up to the next disc. Let's get an AP. Now I'm off to the side. I don't know if I'm off on the right or the left side. So to correct where my tip is, I have to know if I'm off on the left or right. Actually, that looks pretty darn good. I'm kind of in the middle there. All right, so we're going to slide up a little bit. You can see he's got some scoliosis. He's a little bit tilted off to his right side, my side. But we're not here to fix scoliosis. We're here to fix these two discs. Shot. All right, I got to move my way up. Shot. And up. Shot. I'm just about where I need to be. Shot. All right, I'm in front of the disc. Shot. Wait. Shot. Nope. Shot. Let's see if I'm to the left or right of the spine. Go. We're going to get another AP view. Shot. Just line that up, please. All right, so I'm in the center, which is great. That's where I want to be. All right, lateral. I'm in the center on the front back view. Now I need to be over the center of the front of the disc. Shot. So I need to correct just a little bit and go up a smidgen. Shot. That's good. Now that I moved my tip, I need to check the AP view one more time. You can never be too cautious or safe. You don't want to be off by more than 5 millimeters. That's perfect, right in the middle. So I like it. I'm going to go ahead and advance my tip through the annulus in the front of the disc. Shot. That's very nice. Shot. Yes, good. All right, I'm going to do another discogram. Shot. But before I can inject dye down there, I need to clean the tip because it's hollow in the middle. Any questions? Feel free to ask. Shot.
Yes, we
Shot?
just got a question from Royal ViewTube on YouTube.
Excellent. Thanks for joining us.
Saying, Doc, now that Donald Trump is the new president, you think we can
Shot?
get him to have your procedure, the standard procedure for spine surgery?
I am Royal YouTube. I am praying. I am truly praying every day that our government will be strong enough and insightful enough, caring enough to actually make these treatments available to everybody. The insurance companies will not do it willingly because they realize everyone's going to want these treatments. And they don't want to pay. The insurance company doesn't want to pay. They want to keep their money. And they realize that the current treatments available that they pay for, like fusions, artificial discs, are so scary because of the complications and the side effects, and the recovery is so bad and so dangerous. They realize, these insurance companies realize that because their beneficiaries or patients can only have these bad, dangerous procedures, that a lot of the patients refuse the treatment. And that's what they want. They want the patient to refuse the doctor's treatment. And when I was doing fusions, I had a really good reputation, by the way, and artificial discs. Patients came from all over for me to do their surgery, but they, even then, I got about 50% of my patients would do the surgery, the fusion. The other 50% said, heck no, and they refused it, okay? So when the insurance company has a procedure shot that 50% of the patients say no themselves, they don't want it, then they don't need to say no. The insurance company doesn't need to deny it, right? And denying treatments is bad. It makes them look bad. They don't like that kind of publicity. It's really bad in the news when there's a man or woman with cancer and the insurance company says, we're not paying for treatment. And those people then get to the media and they complain. And the media used to actually talk about those situations because they were real situations. But now the media has been bought off and they don't air those types of stories anymore because the insurance companies are paying the media to not show those kind of stories. Does that make sense? And people don't realize that's how the media works. But that's how media works. Special interest companies and groups pay the media, the news channels, to not show stories or to show stories that they want them to show. Shot? And the thing is, the insurance companies don't want the public knowing that they're doing bad things. So they pay off MSNBC and CNN and, probably even Fox News. All the media channels, they pay them off to not run stories like that, okay? For example, let me see, shot. When America withdrew from Afghanistan under Biden and Harris, we left behind soldiers. They died. They were brutally tortured. But you don't see that in the media, do you? Just on Fox you do. You don't see it on the other channels, MSNBC, CNN. They just won't run those stories because they're very pro the government and they want to do what the government wants them to do. They only want to tell the stories the government wants people to see. To me, that distrust, that lack of freedom of press, that suppression of the truth is bad. And the insurance companies have tremendous control over media and the stories they run. And they do not want the American public to know that they are denying treatment to patients who have cancer. But they do it all the time. I mean, have you guys noticed these commercials for like St. Jude and for these other hospitals that care for sick kids? And they live off donations from people like you and me. Why? Because their insurance aren't paying the bill. And so they've given up on going to the government to get the government to help them get the money from the insurance companies. They just ask the public for the money. Guys, it's too dark here. Why is it so dark, Luis?
Can we increase the...
Will you get me more light output, please?
Yes, sir.
Sorry, guys.
Can you do the...
I need 2 levels up. This is too
Yeah.
dark in here. Now, I don't know that that's helping. Again,
Also the
that's
bottom
not
one.
doing it.
Also the bottom one, please. Increase the brightness there.
Someone teach her how to do it. All right, that's better. That's better. Right there. No more. No more. Yeah. All right. I'm here at the back of this disc, and look at this stuff here. I want you to tell me what color that is, Henry.
That is red.
It's pinkish color, right?
Pinkish, yes.
The reason it's pink is inflammation. This is why this patient has so much pain. He has inflammation happening in the back of the disc, just like the other one. This inflammation should not be here. It's not normal. There should be 0 inflammation in the back of your disc. So why does he have inflammation? The answer is herniation. Herniation makes inflammation. Let's show the audience one more time the video, 10 minutes, Dr. B. The video on how a herniated disc causes so much pain in the neck.
Copy that.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. You can see from our animation that the back of the disc has a tear in the wall called the annular tear. posterior annular tear because it's in the back, and versus anterior lateral. Anterior and lateral tears do not cause pain. They may get inflamed, but they never cause pain. So it's the posterior annular tear we care about. That's where all the pain comes from, and that's what we're here fixing. Also, it happens to be where the spinal cord and nerves are. So there's probably an evolutionary advantage to the development of pain nerves in the back of the disc where the spinal cord and nerve roots are that notify the person that they're having pain there, so they take it easy and they don't make the herniation worse and become paralyzed. Because that's really what's happening, right? So back here at the back of the disc is where the spinal cord is. If you damage the spinal cord with a herniation, you'd be paralyzed. So God, in God's infinite wisdom and design, designed the back of the disc to be painful. So that when people like, Stone Age people were going around getting hurt, herniated disc in the neck, spinal cord is at risk of being damaged by the herniation if it gets worse, they give the person pain, the caveman pain or cavewoman pain. They sit there and go, oh, bunga bunga, my neck hurts, I'm going to take it easy. What they're really doing, they're avoiding pain, but they're really avoiding a spinal cord injury and being paralyzed. Because being paralyzed, it doesn't matter where in human evolution you look, being paralyzed is not an advantage evolutionarily. It doesn't give you better reproductive ability or better ability to collect resources in your environment or compete with other humans. It's always a disadvantage to be paralyzed. So the fact that these herniations in the back of the disc here where the spinal cord is can cause paralysis if they get worse, and now you're feeling pain, that's a sign, hey, take it easy. It's actually an evolutionary advantage, an adaptation that is advantageous to preventing worsening of function. I don't know if that makes sense to most of you, but I just love evolutionary biology. It is one of the things I absolutely love is looking at behavioral evolution, physical evolution, genetic evolution, molecular evolution, physiological evolution, basically how over time organisms that are better adapted to their environment survive and create more organisms called progeny, babies, and then those progeny end up, some of them, with even better adaptations, better traits that allow them to adapt to their environment even more and better than their parents. And those ones, they end up surviving and reproducing and doing better in the environment, having more babies, more children, and then their children have also, they pass on that phenotype, that physical characteristic that allows them to be so well adapted to their environment, and their kids get it, but there's mutations and genetic variation which allows their kids to have either better or worse adaptations, and those with worse obviously don't make it, but the ones that have better make it and reproduce, and the cycle goes on. All right, so it's pretty damn cool. All right, questions? I got 5 minutes left on this disc. This is the last disc we looked at. 6-7 was more burned out. This one is fresher. Look at all this material here. This is all bad stuff causing symptoms. That's the fibers of the posterior longitudinal ligament right there for neurosurgeons who understand that. I know we have some watching. Those are the PLL fibers, okay? And I don't want to do anything with those because they act as a barrier to herniations going back to the cord. And by the way, the first surgery we did, there's another piece of herniation, by the way. The first lady we did, she's already ready to go home. She's like calling from the recovery room saying, can I go home? And I said, no, I want to come say hi first. She's hungry, apparently. No pain, ready to go home. And she's coming back next week, I think, or the week after to get her back done. Yeah. So today was her neck. She's coming back to get her back done. Yeah. Oh, look at that herniation right there. So nice. I got probably maximum 5 minutes left. If you have asked me a question, I will answer it. Don't worry. Don't leave. I'll give you the answer. But I'm not going to give it to you this moment because we have some other stuff to show you first. Henry, will
Yes,
you
sir.
show our audience how the Duke laser disc repair works?
Of
Thank you,
course.
Luis.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see how we use the endoscope and the laser to find the tear in the back of the disc along with the herniations. These are all pieces of herniation coming out. I have floated out about 20 pieces so far on this disc. The last disc we had fewer because it was more degenerated, but there's another piece. You see that? It literally just popped out. It was pushing on the nerve. It popped out of the foramen on the left at C5-C6. Almost done. There's another herniation, another herniation. Look at all these pieces of herniation. Each one of them is its own herniation. Most people think a herniated disc is one herniation. It's not. It's about 30 pieces of herniation. And the herniations don't all happen at one time. They happen over years. And as the more herniation comes out, then the symptoms get worse. Patients get more debilitated. They get more weakness, numbness, atrophy, tingling, pain, and then eventually they go, I can't take this anymore, and they go see their doctor, get an MRI, and then a lot of times they're referred for surgery, but they get the wrong kind of surgery. They're getting invasive fusions. Each of these is a herniation. Look at that. There's another piece right there. Big one. I know you have questions. I am going to answer them, but I was kind of hoping I could finish all of our animations. And then, now this patient may have facet pain. I already told him. This piece is so big it won't come out. So I got to grab it out. Henry, let's show the audience the second most common cause of neck pain, which is facet pain.
Of course.
Grab her. Welcome back. You can see from the video that the facet joint is injured just like a disc with trauma, that trauma then causes the facet joint capsule to tear, and once the capsule's torn, the joint becomes unstable, it wiggles around, and it gets inflamed, causes pain with movement, stiffness, a lot of stiffness and pain. And you can either feel popping or cracking in your neck. That's the facet joints. How come I don't have irrigation, guys? What's going on? I have very little. I'm not able to float anything out. Huh? What's uh-oh? What does uh-oh mean? Jesus fucking Christ. Let me know when you have it. It looks like it's getting better. Yeah. All right. All right. All right. So good. Thank you. What happened? The machine went kaput? I mean...
It's probably the bladder is just disconnected from
Bladder?
it. Yeah, probably the bladder.
And can that be repaired?
No. You just put it back actually.
Oh, the bladder popped out?
No. You just get out from the hole and lose the pressure. So.
Oh,
Yeah,
okay.
you just set it down.
All right. All right. All right. We're almost done. Another minute or two. I don't really see much in the way of herniation left. This is the foramen on the left side at 5-6. You can see the tear in the annulus. You can see a little bit of herniation still left right here. And maybe a piece or two popping out. There's one right there. Just came out of the foramen. That's what's pinching the nerve, causing the arm symptoms. So when you get a herniated disc with numbness, tingling in your hand, that's what's causing it right there. Those little pieces that are inside that space right there called the neuroforamen. And that's where the nerve root lives that goes down your arm. In this case, number 5-6 disc, it would be the C6 nerve root. And the C6 nerve root goes to the biceps, right? And it goes to down your arm to your hand. Typically it goes to the thumb and up to the middle finger, sort of. Everybody's a little different. The next nerve root, C7, goes to the middle finger and towards the pinky. C8 is the pinky. Just about done. A minute left. Dr. B, everything is looking good here. I'm just going to peek the other side. Type your questions up. There's another piece of herniation. I will answer your questions. It may not be right this second, but I will answer them in a few minutes. I'm going to head back to our broadcast room where Henry is, and I will come and talk to you and answer your question face to face. Okay? So feel free to ask me questions. Try to stay away from political questions. I don't like to talk politics. I don't consider myself an expert on politics. I am an expert on spine. And unfortunately, the naughtiness of the insurance companies. All right. Henry, what videos do we have left to show our audience?
We can show how the
facet pain?
Yes, how Duke plasma rhizotomy cures facet pain.
Let's do that.
Perfect.
And then I am just about done, so you'll see me finish up in the next 15 seconds, and we're going to be closing up and moving on.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Okay, welcome back. You can see how we treat facet joint pain different than other doctors at Duke Spine. We have a permanent cure, and it's called the Duke plasma rhizotomy. All right, getting back to this patient, we are done. We've taken the tube out. The tube is called the tubular retractor. The endoscope's out. I wanted to show you all the incision. It is literally 4 millimeters. It's tiny. We're going to close it off with a tiny little Band-Aid. And I want to show you this right here. This is the pieces of the herniation. Not all of them, but probably about 30% of them. The rest of them ended up in our suction bag. But you can see there's quite a variety in size, right? Some of them are bigger, some are smaller. And there's even more here. So each disc, on average, has about 30 pieces, varying sizes, of herniation. And we use the laser and the irrigation and to get rid of them. All right, we hope you enjoyed it. I'm going to answer your questions. Type up your questions now. I'll be there in about 5 minutes, and I'm going to answer your questions for you face to face. So go ahead and type them up. In the meantime, Henry, why don't you show our audience another one of your amazing videos?
Of course. Thank you.
And good morning, I'm Dr. R. Duke Majan, CEO and founder of the Duke Spine Institute. I'm here with one of my patients who's traveled far to come to Duke Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again, so I did some research. Found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion, though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4mm incision, and we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great, feel very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4mm incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Duke laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need the surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery, and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
yeah,
it's not the case right now.
I think, yeah, well, you could do. Oh, yeah, it's a little overcast right now. Yeah. But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right, congratulations. You're welcome.
Thanks again.
Good morning, I'm Dr. Duke Majan. I'm here with one of my patients from Canada who traveled actually from Toronto to Florida to have Duke laser disc repair to fix 2 herniated discs, one in his neck, one in his lower back. And you had your lower back done last week, and we were actually supposed to do your cervical last week, and we had our air conditioning break, and we got it fixed over the weekend, and you had your neck done yesterday. So you've actually had the Duke laser disc repair done on your neck and your lower back. How's your lower back feeling?
Brand new.
Amazing,
As
huh?
if it was never injured. I still am in shock. I can't believe that you were able to achieve this result after I've been suffering with this problem for just over 5 years now.
Yeah, since your accident.
Yeah.
Trauma is the cause of herniated discs. You herniated your disc in your lower back. You had pain for 5 years. In Canada, what did they do to treat your pain in your back and your neck?
I started with medications, nerve meds, narcotic painkillers. I was instructed and told to have nerve block injections to help with pain management. I did physio, I did chiro. Finally, I got to a point where I started to do the nerve ablation therapy, and
All right, well, we have terminated the testimonial early. Testimonial termination. But good news, you can watch all of our testimonials, and we literally have hundreds and hundreds and hundreds of patients. Testimonials on our website at dukespine.com. And we have testimonials for lower back surgery, neck surgery, but generally our patients do very well, and we're able to get rid of about 99.6%. Round that up to 100% of the neck pain and back pain that people come to us with that is caused by disc herniations, which is about 85% of the main cause of neck and back pain is disc herniation. So if you come to us with a disc injury, whether it's a bulging disc, protruded disc, extruded disc, slip disc, bulging, herniated, whatever, there's so many names, degenerated, spondylitic, they're all the same thing. They're a tear with a herniation, and it's just a matter of how old the herniation is. As over time, the disc collapses, becomes degenerated, but degeneration starts right after you get a bulge and the inflammation sets in. Point is, disc problem, come to Duke Spine, get the Duke laser disc repair. 99.6% of that pain will go away. Now, if you have other pain, like from your facet joints, like we showed you during the surgery, or you have in the lower back, you can get the SI joints, sacroiliac joints causing pain right near the butt crack, and then you can also have the piriformis muscles causing pain. That's usually the top of the buttock. If you have those types of pain, we can fix those as well, but they require different treatments. You've seen some of those treatments today, and I know we have a few questions, so I'm going to go ahead and take the questions. If you have questions, feel free to type them up.
First question coming from Smarzig on YouTube, asking, are you training other doctors?
Yeah, so I am training other doctors. I hate to say this tongue-in-cheek, but right here, there are doctors watching these surgeries on YouTube and Facebook and X, LinkedIn. They're watching these streams, they're learning, and I'm happy to train other doctors. We have to work out an arrangement for training, but in the end, I want to train more doctors. To train more doctors, we have to have something called demand. Now, demand and supply are two things most people know a little bit about, but if the supply is too great and the demand is too small, then you have an overabundance of supply and you have not enough demand. Patients that need this service, there's millions of them, but they don't come here for various reasons. Number one, they live far away and they think traveling to Duke Spine is inconvenient, which it is. I recognize that, but it's worth it because the treatments you're going to get where you live, they are shitty, horrible, bad, dangerous, ineffective treatments, period. I say that with conviction because I know that. I used to be a doctor doing all these invasive treatments and shots and medial branch block and RFA and stimulators. We did it all for years, and we figured out that they don't work. They don't give people lasting relief. People come back with the same pain with those types of treatments, or they have worse problems. So what we decided at Duke Spine, what I decided since I'm the CEO and founder, is we are only going to give people the very best treatments that actually work for their problem. And they're the least invasive, the safest, the most effective, and they last a lifetime. And when you look at what treatments are the safest, most effective to get rid of the symptoms coming from that area, they last a lifetime. In other words, you do it once and never do it again. They are the Duke laser disc repair for disc pain, the Duke plasma rhizotomy for facet pain, SI pain, and facet and SI, right?
Yeah.
And also for hips, knees, and shoulders, we're rolling out now. And then you've got the Duke piriformis release for piriformis pain. And by the way, 99% of neck pain and back pain are fixed by those 3 treatments. So those 3 treatments are treatments that I created. They're only available here. So if you're not coming here for those treatments, you're getting crappy old treatments that don't work, period. You can get angry with me, you can say I'm a bastard, I hate Dr. Duke, he's a liar, call me whatever the hell you want. But you will learn someday what I'm telling you is the absolute truth. It's a lot like Einstein. Einstein talked about black holes and space and time and folding space and time and relativity, and the people of his day, they thought he was crazy. But in fact, the guy was so advanced in his thinking that even today, scientists, astrophysicists that challenged Einstein and his theories, they end up wrong and Einstein is right. So how could one man, Einstein, a scientist, a true mathematician, and there's more like him, by the way, I'm using him as an example. There are scientists that make discoveries that are true discoveries. They are factual, based in fact, all right, not just bullshit. And Einstein is one of those. My discoveries are the same way. 100 years from now, everyone will be doing the Duke laser disc repair. Why? Because it's cost effective. It is the only treatment that works and lasts, and it is the safest treatment available. And if there was a better treatment, trust me, I would be developing it. I would know about it. But I can't think of a better treatment. I've thought of all the ways we could treat the tear in the back of the disc. I've thought of all the ways you can treat the nerve that causes facet pain or carries facet pain and the piriformis syndrome. And there is no less invasive, more effective, more durable, safer, faster recovery. Not even close. These things are so far out there, so far advanced, that it's going to take all these other doctors literally 100 years to catch up at this point. Okay? So when you ask, am I training other doctors to do the treatment, we need more supply in order, and we need more demand, I should say, in order to create more supply, more doctors. Okay? Right now, I do surgery 2 days a week. Most of my weeks now, I'm doing 1 day a week because we don't have enough patients coming. So when we get so busy that I can't keep up, that's when I'm going to be like training another doctor, standing next to me, making them hold the endoscope, use the laser to make sure that they do it right. Until then, I'm not really training other doctors until there's more of a demand at Duke Spine.
Next question coming from Linda on YouTube asking, hello, how long is a patient who is from out of state required to stay in Florida?
Hi, Linda. About 80% of our surgeries you watch are patients coming from out of state. They come for 3 days. And if you're just having one body part fixed, like your lower back or your neck, you only need to be here 3 days. So Monday, Tuesday, Wednesday, you can go home Wednesday afternoon. You can fly home, drive home, whatever you want. Or Wednesday, Thursday, Friday. So we kind of do either Monday, Tuesday, Wednesday, or Wednesday, Thursday, Friday. It's one of those 3-day blocks. Could you do 2 days? Sure. Could you do 1 day? If you really wanted to, we could just do 1 day. I don't recommend it. I would have to have your preoperative clearance done before you get here. And then you'd show up in the morning of surgery. I would check you out. We do your surgery that day, and then you can fly home that night. So, is there a 1 day option? Yes. I don't like it, but it's okay. It's safe. We could do it. 2 days, yes. 3 days, yes. But most people come for 3 days. Some people stay for Disney or Universal or NASA. They like to go and look at the rockets launch and stuff like that. So 3 days is typical.
Next question coming from JG on YouTube.
Hello, JG.
Asking, what is a rough minimum estimate of costs for a C5 through C6 disc herniation and a C6 through C7 slip disc?
Great question. So you're asking me what would be the cost roughly for 2 discs in the neck to be fixed. Again, I don't have those numbers, I really don't. And a lot of it depends on insurance, whether insurance is going to pay for it or not. Sometimes we know we can get the insurance to sign a contract ahead of time where they're guaranteeing payment. If that's the case, which doesn't happen often, it's about maybe 1 in 10 patients. If we can get that to happen, then the cost to you is minimal if your insurance is going to pay, and we know that and we have a contract. On the other hand, if you have no insurance and you're completely out of pocket, 2 discs in the neck could cost as much as $30,000 or $40,000 US dollars. Okay, I just don't know the exact amount. The only way to find out the exact amount of what your procedure will cost you out of pocket is to do an MRI review where I make a diagnosis, a treatment recommendation, and then you get that treatment recommendation. You'll know exactly what your costs are before you come here. We're not trying to trick people. We just need to know what needs to be done surgically before you get here in order to give you a cost before you get here. Sometimes patients come here and they surprise us. They have a new kind of pain that we didn't know about, and it just popped up since they did their MRI review. We find it when they come here, we notify you about it, and there will be an additional cost for that. That's not common, but it happens about 20% of our patients that travel here. So 1 in 5 chance that we will discover another cause of pain while you're being examined.
And then lastly, these next 2 questions come from the Classic Carnut on YouTube.
Classic Carnut, welcome. It's been a while.
First question they ask, have you heard of Dr. Kim and his less laser surgery? How are you different? Thank you.
Yeah, Dr. Kim is a Korean surgeon, and he has a name called less. It's I don't know if it stands for lumbar endoscopic spine surgery. Nobody does the laser procedure that we do. It's called an annular debridement. Now, if Dr. Kim watches my surgeries enough, he will learn what I'm doing, and Dr. Kim can do what I do. And he can do the Duke laser disc repair. He can't call it the Duke laser disc repair, but he can do the Duke laser disc repair. How is it different? He's not doing an annular debridement. He's only grabbing out pieces of herniation with a grabber. But the laser is the key, and if you're not doing an annular debridement, which I'm the only one who does in the world, then you are not getting rid of the patient's back pain or neck pain. So I would not recommend Dr. Kim. Dr. Kim also removes bone from the spine. He's drilling a hole or removing bone, taking bone out of the back of your spine to get to the herniation, typically. All right? So that I would avoid that, because that's only going to weaken and destabilize your spine. We do not take any bone or ligaments out of your spine. Other doctors do. Duke Spine is the only company that does not. The reason we don't is because all the other doctors want to do what we do, but they don't have the training, they don't have the expertise, they don't have the right equipment, the right tubes, the right endoscopes, the right instruments to do what we do. They all do a typical paramedian approach. They go down, they remove bone and ligaments. That's weakening your spine just to get to the herniation. Then they don't treat the annular tear. So I would avoid it. If I were you, come to Duke Spine. Don't gamble with your health. Folks, don't gamble with your health. Right?
Yeah.
You want to gamble with your money. You want to gamble where you go get a hamburger, right? Should I go to McDonald's? Should I go to this other place? But don't gamble with your spine. I mean, to me, this is like a no-brainer. You don't gamble with surgery. Surgeons are not equal. We are very different. You understand? And most surgeons, they're careless and clumsy and lazy, and they will make mistakes in your body. They're going to make mistakes in your body. And guess what? They don't tell you they made a mistake. How many patients have come here with swelling after surgery? Oh, spinal fluid leak. Did your surgeon tell you they gave you a spinal fluid leak? No, they never mentioned it. Did you have headaches after your surgery? Oh yeah, they had headaches for weeks. Yeah, you had a spinal fluid leak. They never told you. Surgeons hide their mistakes. I don't. You're watching my entire surgery. I can't hide it. You're watching it in live stream, real time. How many surgeons in the world can do that? Literally, I'm the only one. I'm the only one, and we've been broadcasting my surgeries live from beginning to end for 10 years, ever since I could broadcast them live. Okay, why do I do that? Because I have nothing to hide from you. Other doctors do, which is why they don't broadcast their surgeries live, which is why all you get are little pieces of surgery that they want to show you, and they're hiding bad stuff, okay? So don't be a fool. Go to Duke Spine, get the best surgery in the world, avoid bad surgery, come here, be safe, get an effective treatment.
We have more questions, but this next one coming from the classic Hard Up once more on YouTube, asking, when is your movie coming out? Looking forward to it.
When is our first installment or movie coming out? It's supposed to be January. I talked to our director who's editing the movie right now. And we shot the movie over the summer. So the movie was shot in San Diego. For those of you who don't know what we're talking about, this movie's called Spine Scam. It is an expose. It's a docudrama. It's got really interesting plot, interesting characters. But basically, it's an exposure of the spine industry and how corrupt it is. Okay, what's happening out there are companies that make billions of dollars profit by putting implants. They're called implants. They're basically screws, cages, rods, you know, this kind of stuff into you. All right, this kind of stuff. You go to the surgeon, they tell you need this. They need a fusion. You need metal put in your body, right? Or a stimulator, right? And oh, what other options are there? That's it. Okay, that's not it. There's now the laser surgery that we do and the plasma surgery. They're not going to offer you that. Why don't they offer? Because number one, we make a lot less money profit to do these laser surgeries than we do fusions. Fusions are much more profitable for the surgeon, the hospital, the implant company, everybody. Everybody makes more money. So what we're doing here at Duke Spine, we're making less, but we're doing what's best for the patient. So we're going to expose the industry. It's a great movie. It's being sound edited. If you know anything about movie editing, which I'm learning, editing the sound is the hardest part of the movie, right?
100%.
And you have to basically, when you shoot a movie, you're shooting a scene, but you're not recording sound, okay? You're not recording like the river in the background. There's no music. There's no, the voices of the characters, you don't hear them because they're too far away. In the old days, they used to use booms and they would hold the boom mic up and they would try to get the sound, but there's all this background noise and stuff. So what modern day movie making techniques, they shoot the scene and then they add the voice in from a studio with mics, all right? So that's what we're doing right now. It's the final stages, plus we're adding sound, a sound score. All that's being done. We expect the movie to be finished in December, and we're going to put it out for distribution, which basically means we're going to see who wants to buy it and stream it. And when they buy it and stream it, I think they have 3 years rights to stream it. So we'll see. We'll see if we can sell it. I don't know. Maybe nobody wants it. Either way, it's going to be on our website. In January, we're going to be streaming it there. And you can just get on there and check it out.
We have coming from Raj on YouTube asking, you said 99.9% of neck pain or other spine pain requires surgery. Why is that, sir? Can neck issues cause headaches and tinnitus? And what do you think about orthobiologic injections?
Well, Raj, loaded questions. Thank you. And thank you for noticing what I said. You are correct. 99% of, and I want you to pay attention, chronic pain, okay? Chronic pain. This is important. What is chronic pain? Chronic pain is pain in your neck or back that lasts more than 2 weeks, basically. 2 weeks. Everybody's got a different definition, but 2 weeks is the real cutoff, okay? So you have acute pain. Acute is not cute. It's acute. It's A-C-U-T-E. It's pain for the first, it's something that's 2 days, basically 48 hours. Then there's subacute, which is 48 hours to about 2 weeks. And then there's chronic, which is after 2 weeks or longer. So chronic pain in the neck or back, the cause of that pain is exactly what you see in our video. It's disc, facet. For the lower back, it's piriformis and SI. So disc, facet, piriformis, SI joint. 4 things. They cause 99% of chronic back pain. 1% comes from fractures, tumors, infections. They're not things that we treat here. 99% of back pain comes from disc, facet, SI, piriformis. We now have a cure for all 4. The disc is the Duke laser disc repair. Facet is Duke plasma rhizotomy. SI is Duke plasma rhizotomy. Piriformis is piriformis release. Done. 99% of back pain. And yes, they're all surgical procedures. Some people would call them pain management procedures. Same thing. You're making a cut, you're going down, and you're cutting something or treating something. But it is a, minimally invasive procedure for all of them. Back pain and neck pain do not go away on their own. They get better. Some people will have pain, chronic pain. It gets better for a few days, a few weeks, a few months with some shots, some behavioral modification, but it always comes back. It always comes back. And eventually it comes back and it stays all the time and it never goes away until you get it fixed. So what I said is that chronic pain, which is most pain, 99% of it requires surgery, and we have those surgeries at Duke Spine to fix them. So yes, they require surgery to get rid of it. You can do other things, pills, shots, therapy, massage, injections, whatever. You can do all those things, but they are not going to cure the pain. They're going to temporarily make it better, and then the pain will come back. So there are people who live with pain for 30, 40 years, miserable. They've modified their life. They don't do fun things anymore. They don't go hiking, camping. They just kind of exist. And that's the people we're targeting. We want the people that are existing because they're in pain when they do too much, come here, get fixed, heal, and go back to a normal life. That's what we're offering.
And then these next 2 questions.
And he asked about these ortho something injections.
Oh, yeah. What do you think about orthobiologic injections?
Yeah, orthobiologic injections, garbage. It's just a moneymaker for companies that are manufacturing these orthobiologics. Garbage. Don't do it. It's not worth it.
These 2 questions kind of intertwine with each other in context. One coming from Adam once on YouTube, and JG once more on YouTube, asking what procedure like that is out of pocket. Rough guess. And does traditional Medicare cover these procedures?
Which procedure?
I believe this one. And
so the question is about insurance again.
Yeah.
I love the insurance questions. Insurance companies do not cover all medical treatments. That is 100% factual. For example, if you have stem cells injected, insurance companies don't cover it. The question was also about Medicare specifically. So for those of you who don't know what Medicare is an insurance plan that is it's a governmental insurance plan in the United States. It's a big bank account that our government basically takes money from workers, people working. They take these taxes. They're called FICA, F-I-C-A, and FUCA, F-U-C-A. It's really FUCU tax. And they put this tax from every paycheck, this very small amount. It's like 1.3%, maybe a little more or less now, but that was years ago. 1.3% of your earnings. They take that and they put it aside into a fund called Medicare. Now that big amount of money sits in an account, and people that are 65 and over that have Medicare insurance that they paid into their whole life, right? You get that benefit of having Medicare insurance. Medicare is managed in the United States by very corrupt insurance companies, very corrupt private insurance companies that are for profit. Most people don't know this. They do it 2 ways. One, there's straight Medicare, which is managed by what are called MACs, M-A-C, Medicare Administrative Company. Now, MACs have divided the United States up into territories, and there are a lot of territories, and I'll show you. It's most people have no clue about this. Here, maybe I'll send this to Henry so he can pop it up one day. Here, on my phone. Here are the territories. All right, there they are.
Yeah.
See the colors?
Perfect. Yeah.
That is not the election map. So, for example, the blue one here, California, right, and maybe Nevada, it says Noridian, N-O-R-I-D-I-A-N. And if you look at Florida, right down here, Puerto Rico, right there, Florida, Puerto Rico, and the Virgin Islands, FCSO, stands for First Coast Services Organization. What is First Coast Services, right? It's all there to confuse you. First Coast Services is Blue Cross Blue Shield. They corrupted their way into the government, saying to the government here, this is what they said. Blue Cross, Government of the United States, Government of the United States. My God, the Medicare money is depleting. We're going to be out of money in years. I don't know what to do. Blue Cross Blue Shield and United Healthcare, Humana. Government, let us manage the benefits. We'll save you money. Oh, that sounds good. Yes, we will take care of it. Don't worry. You have $100 billion in Medicare. We'll make sure that you keep $100 billion in Medicare. How is that possible? Oh, because we're going to manage the benefits. What do you mean? Well, when a patient wants to get treatment, we'll decide if we should pay for the treatment or not. Oh, that sounds good. Yeah, but isn't there a potential for abuse? Oh, don't worry about abuse. We're not abusive kind of people. We're insurance companies. We would never take advantage of beneficiaries. Oh, what's in it for us? Well, next time you want to run for office, we'll be the ones to contribute to your political campaign and make sure you get elected. Oh, I like that. So what do we got to do? You just got to vote that Blue Cross Blue Shield, United Healthcare, and Cigna, and Aetna, and Humana can carve up the United States into territories, and we'll each have a monopoly, and we'll be able to run the benefits for Medicare. We'll pay all the bills, but we'll make sure we don't run the bank account down. Oh, that sounds really good. And I like the part where it's so corrupt, you're giving us money so we can win the next time we run for office. Oh yeah, we knew you'd like that. By the way, we need the authority to deny treatment. So if a doctor or hospital recommends a patient get treatment, we need the ability to say, no, we're not paying for it. Oh, sure, I guess we could do that. But won't people be hurt when you do that? Don't worry about it. We'll have scientific evidence backing our decisions. Sounds good to me. Okay, go for it. Well, oh, one more thing. Every dollar we save the Medicare and the government, we want 30 cents on the dollar. That goes to us. Oh, so when you save a dollar for the government, you get 30 cents, but we keep 70 cents. Yeah, that's how it works. I guess that's okay. Go ahead, take your 30 cents on a dollar every time you deny treatment. And that's how Medicare was born. That's how Medicare is run today. Now, there's a second type of Medicare. Remember, I told you there's two. The other kind is called Medicare Advantage plans, which among doctors and hospitals, we call them Medicare Disadvantage plans. Same concept. They are going to deny care. They manage the benefit. The government pays them $1,000 per Medicare beneficiary that's enrolled with the Blue Cross Medicare Advantage, for example. Blue Cross takes $1,000 a month for each beneficiary. They may have 1 million people enrolled, and then they've got to pay for the medical care. But again, they deny treatment, and they steer you to cheap providers that don't recommend treatment, okay? So for example, the Medicare Advantage plan will have Dr. Schmo in their network. And they like Dr. Schmo because every time the patient goes to Dr. Schmo with back pain, you know what Dr. Schmo says to the patient? You don't need an MRI. You don't need surgery. You don't need shots. Just suck it up, buttercup. You'll be fine. Everybody has pain when they get older. Oh, we like Dr. Schmo because Dr. Schmo doesn't cost us anything. But of course, the patients believe there's no treatment for their back pain. They're brainwashed to believe that there's nothing to do. All right, don't you love my acting? That's why I never went into acting. But the point is, it's very simple. You're all getting screwed. The insurance companies are taking your money and giving you very little in exchange. Duke Spine Institute is not an insurance company. We just provide treatment. Whether your insurance pays or not, that's your problem. If you're stupid enough to allow your insurance companies to get away with this, then you deserve to have nothing paid for, okay? And I've been telling people the same message for years. It is not the doctor's fault for creating treatments that work that aren't paid by your insurance. It is your fault for letting your insurance companies not pay for your treatment. And you should fight your insurance companies and fight your politicians because you should be getting your medical care paid for. That's my answer for the Medicare question.
Sorry, stretching here. Then we have one more question that just came up from Classic Car Nut, once more on YouTube, asking, good explanation, spot on, Dr. Duke. I notice with your surgeries, you don't show how you inject dye to see where in which the discs are leaking. Is that part of the procedure?
All right, Classic Car Nut, we do inject dye when we do the discs. I'm not sure how you missed it, but on this case that we're doing right now, this one we're wrapping up, we did inject the dye, but I think we injected it while you guys were watching the animation, the 30 causes of neck pain. That's when I injected it. So if you go back and watch in the bottom corner, maybe you'll see it. I know it's small, but it's there. We always inject dye into the disc. It's blue dye. It stains the nucleus. So we do that for every Duke laser disc repair.
And that is it for questions.
All right, folks, glad you had joined us. I hope that I have taught you something. These are not just my opinions. They're based on fact. Years and years of dealing with these issues and learning something about it. So if you don't agree with me, that's okay. Doesn't hurt my feelings. I recognize people will not agree with me. It just means that you need to learn a little bit more, and then you will agree with me. Because my opinions are only based in facts and how I put together the facts to create reality. Okay, reality is based on facts, right? And some people live in a world that they fabricate their own reality. That's not the real world. That's their world. And they have to use pieces of information less than truth in order to create that false reality. I'm not interested in false realities. I'm interested in the one true reality. That's the world we live in today. And I'm trying to help you guys understand it better so you can navigate it and make good choices for yourself. But when it comes to insurance companies, nothing makes me more angrier because they are deceptive. They are liars. They are the most deceptive, lying group of people in the world. And we will expose them. As a matter of fact, movie number 2 is going to be an expose of the insurance industry. So when you see movie number 1, support it. That's Spine Scam. And then movie 2 will be forthcoming. But I intend to expose all the injustice and corruption in the healthcare system. And then we'll keep going, maybe. Have a nice day. We'll be back in about 20 minutes with a lumbar, lower back pain patient from Vietnam. He's been watching our surgeries now for 4 years. And as a matter of fact, I just saw him in the pre-op area, talked to him for a few minutes. He was on his phone watching the cervical case. And then I popped. And he's watching from Vietnam. He's been talking to me for years, talking about how he's going to come out here and get his back fixed. Well, here he is. He's here now to get his back fixed. So we're actually doing 6 areas. This is a big one. We're going to go in and do bilateral L23, bilateral L34, bilateral L45, Duke laser disc repair. Should be a good case. I expect his pain to go away, and he's